The first exercise we're going to be looking at is ankle pumps. So as you can see in this video here, you're going to move your toes up towards you as far as you can, and then you're going to point your toes down as far as you can. And you're going to move them up and down about 15 times. This exercise is called quad sets. For this one, you're going to want to straighten out your leg as much as possible by squishing the back of your knee down into the table, holding it for about 5 seconds, and then slowly bringing your foot back down to the table to relax. If it's hard to see if your knee is pressing down into the table, you can always put a hand underneath your knee for the first one or two so you can feel it. And you're going to do at least 10 of these. This exercise is called short arc quads. So you're going to want to use a bolster or roll up a pillow or towels and place it underneath your knees. And pressing your knee into the bolster, you're going to kick your leg up towards the ceiling. Hold it for at least 5 seconds and then slowly lower it down, and do this at least 10 times. This exercise is called heel slides. You're going to want to take something like this, so a piece of cardboard or a cookie sheet can work, but you're going to slide your heel up towards your butt and hold it for a few seconds, and then slide it back down the board and straighten out your leg. And then you're going to repeat that 10 times. So slide your heel up towards your butt, and then slide it back down and straighten out your leg. This exercise is called hip abduction. So you're going to want to make sure whatever you were using to slide your heel before is wide enough to slide it out to the side now. And you're going to be sliding your foot out to the side and then back in towards the other leg, keeping your leg straight. And you're going to do that 10 times, going out and back in. This exercise is called straight leg raise. So you're going to want to bend the opposite leg from your surgical leg. And then you're going to want to straighten out your surgical leg as much as possible by squishing the back of your knee down into the table. And then you're going to lift your leg, keeping it straight to about the height of your other knee, and hold for about 5 seconds and slowly lower it back down. And then you're going to do this 10 times. For this stretch, you're going to want to use a belt or a towel, something that's not stretchy, so you can wrap it around the bottom of your foot, keeping a hold of it. And you're going to use it to help you bend your knee as much as you can. You want to hold this for 30 seconds, and you're going to do it 5 times. The goal is to get the back of your heel as close to your butt as possible, and then you're going to relax in between each set. This stretch is going to be stretching your hamstrings or the back of your leg, and you want to sit at the edge of a bed or a chair, put your surgical leg straight out in front of you, and keeping it straight, you want to bend down as close to your toes as you can. You want to hold that for 30 seconds and repeat 5 times. For the last exercise, you want a table or a chair to hold on to, and you're going to kick your foot up, bending your knee, slow and controlled on the way up and down, and do this 10 times.